friends, welcome to yet another episode on DrPoonam's vlog, and this is another episode for the lectures on constipation. Now, in case of constipation, in the first lecture itself, the part 2, I have told that the whole mechanism of how the intestine stretches and why we should be prolonging the medication. But I think there were certain parts which the people did not understand. So there were queries like, okay, why the child is not able to pass when the intestine is stretched. Basically, a stretched intestine. The intestine has many other parts, so I will show some cross section of the intestine here. So the intestine is not only muscle, it has something known as mucosa, that is a sponge like covering on the muscle of the intestine, which helps in absorbing all the nutrients. In the muscle and beyond that, there are nerves which help us understand, yes, my intestine is full or I need to pump. That pumping action, what I said, the milking action, okay, the pump milk which I told in the second episode, okay, that is assessed by the nerves, and the nerves are what gives us orders. Yes, you have to do this, you have to do that. The same nerves gives order even to the intestine that you have to contract, you are supposed to relax, okay. Now, when the intestine is overfilled and distended, neither do the smooth muscles of the intestine nor the nerves do its work. They also become lazy, they also go to sleep, and they don't want to do the work. Basically, they do not get the impulse that at this level I am supposed to contract. That's why the intestine will also not contract till a point wherein the stools become so hard that finally the intestine just gives up, and the baby soils his pants. So that is, they dirty their pant, even though they don't want to do it. So it is called encopresis, which is another term for wherein the child just passes motions. A bigger child, okay, a child of the age who should be toilet trained, passes motions in their pants. And we have many cases of this sort wherein the parents are not adhering to the treatment. In fact, I had two of such patients wherein they would call in emergency only at the end of 8 to 10 months after one follow-up, and doctor, abhi tak theek nahi hua, would be the answer. If I ask them, did you follow up in the last 10 months? No. They have not gone anywhere for follow-up, neither have they come to me. So when such irresponsible parents are there, you cannot help this child. Once we give treatment, our work is to give treatment, right treatment. We are not God, we cannot be, the drones. We cannot be God, we cannot be drones who are going to follow up. Oh, what's wrong with this baby? He is not following up. Once we give the treatment, it is entirely the parents' work to see that the child follows the treatment, he takes the treatment, is responding to the treatment. And for this word responding, the parents have to report to the doctor at particular timings. That is called the follow-ups, okay. So you have to follow up so that the doctor can assess, is this child on a proper dose, is this dose proper for this child to so that he forms soft motions, and they are not hard, neither are they too watery, so that the child gets this overflow of the motions, okay. So we have to maintain this child at such a stage wherein they are passing soft stools and are having no pain, are passing motion once in at least 2 to 3 days. That is, the number of frequency is 3 or more per week. They are not having soiling of the stools, at least less than 2 per month, and there is no pain while passing stools, neither is there blood while passing stool. So when they reach this level, we start maintaining them at a dose enough so that they have soft stools. We try to see that the dose is reduced over time, or if the patient hasn't improved, then we have to see that we are increasing the dose, and this is a properly calculated dose, not that you just increase by 1 teaspoon and decrease by 1 teaspoon, or increase by 1 glass of water and decrease. It has to be properly calculated for that child. So you need follow-ups. that is every month till the baby attains the stage that I told. There are all the 4 criteria that I told, that is soft motion, no blood while passing motion, no pain, no abdominal pain, and no pain while passing motion. Okay, so till they reach this stage, we have to follow them once every month, and once they reach this stage, we have to follow them once in 3 months till maybe 6 months or 1 year, till the time we have to complete that course. Okay, at a point where we feel this baby doesn't require any more medication, we may wean off. At the same time, the modification in the child's activity level, that is exercises, the modification in the child's food, because many of these children are on fast food, are on non-nutritious food, because that is what is being followed at home. Many times both the parents are working, so while coming, get some bhajis, get some pizzas, and sometimes the cake because they are late. This stuff also goes on, especially in metro areas. I'm not blaming parents for that, I'm blaming the Indian system for that, wherein only the mother is expected to do the work and the father is supposed to come back home and relax at home. Please, all those parents who are listening to me and are both working parents, see that mother and father work as a couple, not only at the work front but also in the house front, in the kitchen. So you have to help your partner in each and everything. The child care, child's homework, dropping, picking up the child from school, everything should be done as a couple, and not couple only while posing for photos for Facebook and for some weddings. Okay, the couple means everywhere they have to share the work, from kitchen to the child's school, from the studies of this child till the care of the child. Everything should be 50-50 between the mother and the father. When we reach that stage, these lifestyle problems are something which are especially related to the food of the child will definitely decrease, and our aim should be that. Many a times when the baby starts passing soft motion, or if he gets little bit of liquid motion, that is the time the parents will stop the medication by themselves without any advice from the doctor, just because अब तो problem खत्म हो गया, इसको जब बहुत hard होता था अब तो बहुत पतला हो रहा है यानी problem खत्म. No, that's not the case. There's something known as overflow. Here in the inside I will show one video just for the sake of explanation. I have done that. See, this bottle I have filled with all stones. Now imagine that these stones are your hard stools. Okay, now in this same I am going to add a little bit of water which is colored, because this is the semi-solid motion. Imagine it as semi-solid, though it is just water. Imagine it as a semi-solid motion. Okay, now when your intestine is full of this solid motion, there is space in and around and in between this motion which is almost turned into stone hard. So what happens is the liquid motion which is coming from behind, because your treatment of disinfection is also started at the same time, so the stools which are coming from top are a little bit watery, so this watery motion will just percolate through those hard motions and will come out. So this is one reason. The another reason is all those people who are born in 1980s and before that must have seen this green color soda bottle, wherein we used to have this one round ball like thing at the top of the bottle, and you had to just move that ball so that all the soda will come out. Okay, so imagine if that ball sits on the bottleneck, there is to be no soda coming out. If it comes out of that bottleneck, there would be soda coming out. So your baby's intestine almost behaves like a soda bottle when the motions become so hard. So our aim is to make those all hard motions come out, and in the next video I will deal with the disinfection in detail, and I will explain to you how it goes about and how you are supposed to follow up. My main aim in this whole series of constipation is to give that advice to the parent, which is missing in most of the consultations according to me. Because when we tell the parent, yes, I will tell you take these 3 medications, change the baby's diet and blah blah blah, everything will be told, but these intricacies what I'm telling today are missing everywhere. Okay, so if you are someone who is having constipation, see to it that you see all my videos in the constipation series at least 10 to 20 times, so that you know what you have to do. along with the medications that are given to you, okay, by your doctor, so that the child is treated for once and all. And as I said, constipation treatment is not only medicine, it is medicine with lifestyle changes, with the family changes, with behavior changes, and with changes in which you are going to stay in a rhythm with the nature. We have to stay in rhythm with the nature, so that the way the nature has made our body, we try to contour ourselves to that. So it is not only the baby's problem, it is the whole family problem. So we have to treat the family at large. I hope this lecture I was able to explain why is it that you should not stop your treatment when you get watery motion, until and unless that it is the time that your doctor, after proper follow-up, tells you that yes, now we can stop the treatment. At the same time, you have to escalate your diet. The diet and other parts will definitely follow this video. So stay tuned. Ask me questions, whatever questions you have, in the comment section. Write hashtag DrPoonamsvlog and write in the comment section. I will definitely make a new video. I'm still not coming live here on YouTube because I do not have 1,000 subscribers. If you want me to come live, please share this video so much that I come live as soon as possible on YouTube too. I'm already coming live on IGTV. So if any one of you is there on IGTV, or even if you are not there, please see to it that you go on IGTV also. I have many good videos there on Q&As, that is question and answer session series I have made over there, wherein I answer these regular questions that parents ask me in OPD, also online portal. Hope to see you there in IGTV also, Dr. Poonam's vlog. The link you will get in my description section below, okay, and hope to see you in the next part of this series, as well as hope to see you as my subscriber. Thank you.